Hey everyone, it's Dr. Kindred here to answer some of your questions regarding hair loss and hair transplantation. And one of the questions we have is, can a hair transplant procedure be painful? And what is the recovery time? That's an excellent question. So it can be painful, so that's why we numb you. So one of the first steps is we give you a medication to calm you down, typically Valium. We give you a pain medication even before we start. And then where we're going to do the procedure, right in that area, we numb the area. So the worst pain you should feel should be the needle stick, which feels like a poke from us numbing you. And if it's anything more than that, we'll numb you some more. And we don't move forward without making sure you're comfortable and relaxed. Recovery time, surprisingly, is not really painful. At least my patients don't complain of pain, they complain of itching. And that simply requires a saline spray that we give you at the time that you are leaving our office once we're done with the procedure. And that saline spray really makes a difference with that itching. The other complaint is the numbing medication. If we require large amounts of numbing medication, particularly on the front, then sometimes you can see like a swelling coming down. And that's just the numbing medication following gravity. So typically we tell patients to take off a couple of days just to make sure you're comfortable. Not that you can't work, but you probably don't want to work. Just too much going on. Just lay low. You deserve some of that self-care after a hair transplantation. Next question, which is a good one. Are there any age limits or health conditions that affect eligibility for hair transplant? So as far as age limits, particularly if it's someone with hair loss in their teens or 20s, I tend to not do hair transplantation. And that's because if it's kicked in that early, then usually there's going to be what I call a rapid decline. That is, your hair loss gets stable, it gets worse, gets better, etc. But when it kicks in really young, there's a period where it just really declines. It gets worse pretty fast. We don't want any rapid declines to occur after we've done a hair transplantation. So typically, safely, for example, the hormonal hair loss safely is stable after the early 30s. And then on the higher end of age, you need to sit still for long periods of time. So if you have arthritis, back problems, that doesn't allow you to lay still, then it'll be a little bit cumbersome because it's a very tedious process. We're taking out each follicle at a time. And for that reason, hopefully the Valium or your pain medication allows you to be still for several long bouts of time. But you cannot be on any blood thinners. So if you require an ibuprofen, an aspirin, warfarin, clopidogrel, other medications that are blood thinners, then it would be a very unsuccessful hair transplantation procedure. So that answers age and health conditions for hair transplantation. How long does it take to see results after hair transplantation? Listen. If I could, I would get your hair by Saturday night, but it doesn't work like that. Hair will fall out overnight and then take forever to show up. So if you just do hair transplantation, it can easily take a year before we see the fruits of our labor. For that reason, we tend to do platelet-rich fiber matrix a month before, during, and a month after hair transplantation. That reduces the time it takes to see results. And then sometimes we can see hair growing pretty quickly, sometimes as soon as 3 months, but on average around 6 months or so, we can see a nice steady density of fuzz. So it can cut that time in half sometimes. Next question is, are there non-surgical alternatives to hair restoration that are effective? And the answer is yes. So in my office, hair transplantation is actually the last resort. We always want to make sure that we are improving your nutritional status, making sure you're not doing anything detrimental to your hair. But if it's so far along, there's no follicles, we have to rely on it. So there's that in-between stage where your nutritional status, maybe minoxidil, et cetera, doesn't get you far enough, but maybe you don't quite need hair transplantation. So those procedures include hydrodermabrasion. We suction the gunk out of your scalp and squirt in growth factors. Laser with growth factors. We're going to laser over your scalp so that your scalp will soak everything up like a sponge. And then we massage in growth factors. And then platelet-rich fiber matrix, using the same chemicals that heal your skin when you cut yourself, using those same chemicals to heal your follicles. Then there are procedures out there called exosomes or microvesicles. And there's new amazing treatments that are also coming in. Right now, we're kind of toying around with dutasteride injections. The next question is, what factors determine how much hair can be transplanted in one session? The biggest factor that determines how much hair we can transplant is how many hairs you have to give. So typically we take the donor hair from the back, take hair from the back and put it where the hair loss is. So we want you to have a robust, healthy area of hair in the back. And that determines how many we can remove. On average, it's about 1,500. We try not to go too far past 2,500. And we only take enough so that the back still looks full and healthy. And I just saw one of my patients yesterday will remove 1,500 grafts. And according to her, 127 days ago, she was very specific about how long it's been since the procedure. And looking at the back of her scalp, you absolutely cannot tell. We took out 1,500 hair follicles from the back. How long do transplanted hairs typically last? The transplanted hairs, the procedure is designed for those transplanted hairs to remain for the rest of your life. That is key. So that's why it's so important to know what your diagnosis is to determine the success of hair transplantation. We absolutely intend that when we put that hair in the area of hair loss, it is there for you forever. Next question is, what technologies or techniques are emerging in the field of hair restoration? It is exciting, absolutely exciting for hair now. There's some things that are now old, like PRP or PRFM, tried and true. I talked about lasers and hydrodermabrasion, but there are procedures that are not commercially available that we are waiting for. One is we do a biopsy where we remove about 20 of your follicles. Now, typically, we would send that to a doctor in a lab, a pathologist, to give us a diagnosis. But in this case, we would send it into a lab where they would dissect the follicle, give us what's called dermal sheath cup cells that's found in the root of your follicle. They grow those cells in a petri dish, send it back to us, and we inject it in areas of hair loss. And everywhere we place the injection, hairs grow. That's an emerging one, not yet commercially available. There's others that are theoretical where we can do the same biopsy, but then take your hairs and grow it on a mouse and then send back hair follicles. And they would send us like 1,000 of your hair follicles. And it's an awesome procedure that we're looking forward to. And then what advice would I give someone considering hair transplantation but feeling hesitant? My advice is get a consultation from a dermatologist that does hair transplantation. And that's really key. You want someone who knows the hair disease and the procedure. Some physicians only know the procedure, and some physicians only know the disease. The key is to know your diagnosis. And there's 10 to 15 different types of hair loss. And unfortunately, I've seen cases where the disease wasn't a good fit for hair transplantation. So the bottom line is, if you're hesitant, no worries. You want to gather information from the source. You want to see a dermatologist that does hair transplantation. Here's a nice question. Can you explain how barbers can identify the early signs of hair thinning in clients? So if the patient has long hair, one way is part the hair down the center. And if it's a nice skinny part, they're fine. But if you start to see the part feather out and get a little wide, that's an early sign of hair loss. And then barbers are the experts with hairlines. So if you see the hairline starting to recede, that the hair density is thinner, there's fewer hairs, that the actual hairs are finer, or the hairs are not growing as long, or the hairs aren't as thick as they typically were in the past. Those are some of the early signs of hair loss. And make sure you're connected with the dermatologist to figure out how to link that patient and get that patient in with the dermatologist. If it's helpful, I highly recommend that barbers take the course that we offer. It's STRAND, which stands for Stylist Training, Researching, and Networking with Dermatologists. The website is thestrandnetwork.org, where we have a very intense workshop, particularly for training barbers, stylists, locticians, and braiders about hair loss. And then we'll do one more question. Are there any hair restoration solutions that salon professionals can offer directly? And there are some. Ketoconazole shampoo, selenium sulfide shampoo, zinc pyrithione shampoos, just a little bit, they help the hair to grow. A second thing is red light is readily available. Very few dermatologists offer red light because in our toolbox of things to offer is just not that helpful. But that is something that you can offer in your practice, in your salons and barbershops. There are certain vitamins that patients can take. So there's Xtress, XTRESSE.com. That's available to patients that you can offer to them. Other than that, I would prefer that you work with the dermatologist for anything more that you can do. So for example, I'm the first dermatologist in the country to have a full service hair salon, and the stylist in my office does very simple treatments, but there's still certain things that she can do that are helpful. But I would highly recommend that you only do it in conjunction with the dermatologist. So those are some of the questions that we got. I certainly hope that helps, and see you guys next time.